Hello everyone, here to talk about lower extremity amputation. You might be asking yourself, what is lower extremity amputation? Well, that is amputation that occurs from the hip all the way down to the toes, any of those parts from there. And I'll kind of break it down to the major categories here to give a better understanding. With the first one being hip disarticulation. Hip disarticulation is amputation that is at the hip joint with the entire thigh. Next is the transfemoral amputation. That's above the knee. Amputations occur at any level from the hip to the knee joint and lower portion of the leg being removed. The next being knee disarticulation. That amputation occurs at the level of the knee joint. And then there's transtibial amputations. That's below the knee. Amputation occurs at any level from the knee to the ankle. And now we'll talk about foot amputation. And I'll use my shoe to kind of demonstrate exactly where those amputations occur. The first is the Chopard, or the mid-tarsal amputation, occurring right around there. The next is Les Franck, right around there, just distal of the Chopard. And the next is the Boyds, right around the heel. And then the Sims happens right around the ankle. And the reasons that people have these amputations, according to the University of Michigan's lower extremity clinic, 60% of the reasons is due to diabetes in the U.S., which I thought was a shockingly high number. I've met people with diabetes. I know people with diabetes. I have family members with diabetes, and I've heard that foot care is very important, but it didn't really dawn on me on how important it is until you actually see that number. 60% of the reasons of amputation in the U.S. is due to diabetes. I just kind of put things in perspective on how big a problem it really is in the United States and really around the world. Case in point, one of the guys I researched on was named Graham Parrish, who was a 54-year-old man who diabetic type 1, who managed his diabetes very well his whole life, never had any problems. And then one night, he woke up in the middle of the night, bumped his toe in the dark going to the bathroom, like any of us do. But to him, it was a serious problem due to poor circulation, poor management of his blood sugars. And this just simple thing of just bumping his toe, stubbing his toe, led to an ulcer, which then led to an infection, which led to amputations of the toes to try to stop the infection, which was unsuccessful, unfortunately, and ultimately it led to a leg amputation, which, as you can imagine, would be devastating. And it was devastating to him. He was able to persevere, and now seems to be managing his diabetes as well, but just kind of rings home how important it really is for people with diabetes to manage those blood sugars and how bad it can really get. But let's go ahead and talk about the adaptive equipment that a lot of people have to use. First case here, Hoyer lift. I've never heard of a Hoyer lift really before. I've seen it, I just didn't really know what it was. And I'll kind of zoom in here to kind of give you a better picture of what it is here. In the Hoyer lift, as you can see here, is a sling. It's a sling that kind of goes around the patient. And then there's a contraption here, and then this med person here is kind of controlling it to kind of lift them up. And I thought that was a pretty great way to help somebody that's unable to lift themselves up due to not having the strength or balance or both to be able to do that, especially after an amputation. And one of the guys I researched was named J.D. Smith, and he talked about how when he was in the rehabilitation center, the OT and PT taught him and his wife how to use the Hoyer lift. Not only use there, but they got to use it when they came home, which I thought was pretty amazing. I didn't really think about that being in a home setting, but he made it sound like it really made a big difference for him, especially first being there, not being able to be strong enough to do transfers, which obviously can be very dangerous if you have a bilateral amputation like he did from an aortic aneurysm, which ultimately caused vascular disease, which led to his amputations. Next person I had from a trauma, and his name is Blair Marriott, and he was on a motorcycle and got in a head-on collision and had a transfemoral amputation due to that, and spent about 8 months in a wheelchair after that, an extensive amount of time with a physical therapist in rehab as well, working on strength and balancing skills and just adaptive abilities in general. But staying 8 months in the wheelchair for he's kind of a younger guy, active, and to have to sit in a wheelchair for that long was very difficult for him. And then one day he was actually able to get the okay to use a prosthetic leg and got his first one. It wasn't the most updated one. It was a little more old-fashioned. Didn't have a lot of mobility in the knee, but he said it was able to use it, and it was nice to have the mobility. But then when he upgraded to a hydraulic knee, he said that made all the difference. Now he wears it from the moment he wakes up to the moment he goes to bed every day, and it's just part of his body. He prefers to use crutches over wheelchair and other adaptive equipment, just because he likes, I think, the mobility and be able to stand up. And after sitting in 8 months in a wheelchair for him, I think that was about all he wanted. All these stories are really amazing and encouraging to me because I can't imagine being put in their shoes, and that's something to remember as always being in healthcare is being empathetic to how a person might feel. But the thing that kind of dawned on me most, and the thing that really kind of, I guess, inspired me was really I saw this picture and it kind of put everything in perspective. And I'll zoom in for this. There's a gentleman standing on one leg, holding weights out to the side, with balance, strength, and patience. And those are three things three qualities that all of the individuals I researched had to have. And I thought it was pretty amazing on their positive attitudes. I know not everyone will probably have the same positive attitude and outlooks and outcomes even as some of the individuals I researched. But it is very inspiring to see people not have their self be defined by having a lower extremity amputated. And that's specifically what a lot of them said. It's just because they've changed on the outside and the exterior doesn't mean they've changed on the inside. They're still the same person. It's still who they are. They still like to be able to do these things. And that kind of dawned on me and kind of put in perspective as our job as occupational therapist assistants one day is to be able to help those people get back to living their lives, being themselves, so the best way we can. And to me, that really kind of gives me a little bit more even motivation to finish this schooling and program just to be able to help people like that. And that's about all I have for you guys. And I appreciate your time, and I hope you guys have a good day. Thanks.